with you to talk today.
Hold on one sec. We were talking when the radio thing was still going, so I don't know if people still heard us. So I'll just say it again. Dr. Shealy mentioned the topic today, which is heart disease, but from a holistic perspective. And I think this is a very important topic because, first of all, heart disease, the prevalence, how many people are affected is absolutely tremendous. And the types of heart disease from all sorts of problems, conduction defects to structural to otherwise, even broken heart syndrome, we can talk about that. But there's a lot more to heart disease that meets the eye. There's more to it than medications. There's more to it than bypass surgeries. There's more to it than cardiac procedures. And that's what we're talking about, the holistic approach to heart cardiovascular health. Now, there's a couple of things that we may want to mention in general about health and wellness, if you like.
Well, everything affects everything. I mean, every organ is equally important, but some of them speak louder than others. The brain and the heart speak loudest in general, but there are cells inside the small intestine than there are in your body as a whole.
Yes.
Bacteria. So it's a very complex item.
But this is the thing. And let's talk about cardiovascular health as a function of holistic approach, because this is what we're doing. There are a lot of specialists out there, a lot of smart doctors, a lot of resources that deal with the pathology or what goes wrong with the heart. And that includes conduction defects. In other words, so things like atrial fibrillation, irregular heart rate. It can include heart attacks, heart failure. There's so many things that take place. Of course, the number one cause for cardiac heart issues and heart-related symptoms is, of course, none other than the medicine itself, iatrogenic. In other words, drugs or side effect of drugs and unnecessary surgeries, of course. And those things can cause some harm if it's not necessary, of course. And here's the thing: we're going to figure out today what is the essential foundation for heart health, and we're going to figure out what you can do besides the conventional healthcare system to keep your heart healthy, safe, and running well. So, shall we get started?
Well, remember, all things require good nutrition and supplements. You cannot survive just off the land these days because of toxicity in the world. So in Springfield, the place to go is Spring Valley Natural Foods. That's the friendliest service and the best service in town. And of course, they carry all of items: the magnesium lotion and spray, the 5 bliss oils, everything we have, you can get at Spring Valley. And the average American is highly deficient in fruits and vegetables, eating 2.2 per day and needing 8. You can add 3.5 just by taking Nature Blessed tart cherry juice concentrate. Lowers your cholesterol, lowers your blood pressure, anti-inflammatory, tastes good, smashingly worthwhile, and only in real grocery stores.
Amen to that. I love that stuff, by the way. Really tastes good and does great things for you. Let's start with the foundation of health, however. This is one of the things that we talk about in the holistic holism, and this is something that is probably going to be missing in the conventional system unless you have a really good doctor. Health, including cardiovascular health. Everything begins with a foundation. Everything begins with a human being, whether you're male, female, child, elder. There's actually a blueprint for how humans were created, so to speak, and how they function best. A lot of that blueprint, if you follow that, just like if you follow the blueprint of a vehicle or car, for example, you provide the proper oil changes, maintenance, the car is going to run. The same thing holds for the cardiovascular system. Now, it's a little bit more complicated, perhaps, but the same principle. If you do all the right things, if you give the body what it needs, the body will function okay or well at its best. If you do all the best things. If you don't give the body what it needs and you do all the things that you shouldn't be doing, basically, then the body will break down and fail, including the cardiovascular. And this is very important because the cardiovascular system, the heart, is actually feeding all the rest of the organs. Dr. Shealy mentioned the gut, but there is basically every organ in the body depends on the heart. And if the heart is going well, working well, then it's great. If not, lots of problems. Other things that happen to go with heart disease, I'll just kind of mention a whole slew of symptoms, is the metabolic type symptom. And I remember back in medical school when I was training, I don't know, actually, please bring me back to when you were in school, and that was how many decades ago now?
Six or almost seven.
So 7 decades. Oh, God. You've been around for a while. Yeah. So you've seen some things, huh?
I'm sorry?
You've seen a couple of things, haven't you?
Well, yes. The thing I've seen most is an urgency to walk into bypass surgery. I've threatened for 50 years to have tattooed on my chest, "Do not open." And the thing that's missing in the average physician is recommending a calcium score. It's a simple test, non-invasive test, and it tells you, I think, by age 40, you should have a calcium score. And if you've got 200 points or more, you should, well, work on bypass surgery.
Now, how do we do that? I think I know the answer, but yeah.
The sapphire pouch. It's a leather pouch, or in women, it can be fabric, but with crushed sapphire. And it can lower your calcium score by 200 points or more a year.
Remember when we first did the experiment, I had about 201 points, I think, and as a result of wearing it it was a year experiment, wasn't it? Mine came down to 1.
Yes.
So almost a newborn baby, almost, not quite. Yours came down quite a bit.
Yes. Over a 5-year period, it came down over 900 points.
So that's one thing that people need to be aware of. I do want to get back at this point to the foundation, to the basics. And I just want to build a model of what it takes to have a good, healthy cardiovascular system. Not just a pathology, not just a problem, but a really strong cardiovascular system, health, wellness, and something that will actually keep you from getting into trouble. And the first thing that comes to mind, the very first thing, is the foundation, which is lifestyle. If a person does not have the following, and we can go into more detail here, but of course, there's a lot of detail can be devoted to this. You cannot forget, you cannot ignore the basics and the essentials of living. Nutrition, are you putting garbage crap into your body or are you not? In other words, garbage in, garbage out. In other words, take care of yourself. And by the way, I do want to say organic has been utilized quite a bit. It may be better than non-organic, but with the amount of rain containing glyphosate and all the stuff, Roundup, all the other metabolic poisons, it's literally hard to find proper supply of food. I would recommend, and please feel free to jump in, and about an 80-20 ratio for most people. I'm not talking about people who train for a certain athletic event. I'm talking about basically just everyday humans who want to be healthy and happy. 80% non-starchy veggies and about 20% of good quality protein. Some fruit is okay. Staying away from mostly carbs and sugar and processed. Everything in the center of the store. And it's not a surprise that if we keep putting garbage literally into our system, what happens in our system is it becomes full of garbage. The metabolic syndrome. The so-called metabolic syndrome or syndrome X, how people have described it, at least in my training. Did they use the term when you were growing up in medicine, so to speak, syndrome X, or did they always call it metabolic syndrome?
Oh, yes. But for people who don't know, it's prediabetes and diabetes, basically.
Well, it's several other things too. In addition, metabolism affects everything: diabetes, blood pressure, cholesterol, obesity, triglycerides. And I remember, and I think I've said this before. Yep. I remember actually arguing with a professor, and of course I did not win that fight. But I mean, just I actually learned not to fight with professors at that point uh, about the syndrome X, because the topic of the point of the lecture was we don't know what's causing syndrome X, but we just know that these people have all these things: diabetes, cholesterol, blood pressure, obesity. So how do we fix it? Well, here's the drugs that you use: medicine for this, medicine for that, more medicine for this. Boom, there you go,
and
solution.
and the drugs suck. Every one of them causes increased death in the long run.
So here's the alternative: pay attention to your lifestyle. Start with a foundation, and that's nutrition, but also, second thing, exercise, activity, minimum of half an hour a day, sleep, rest, recovery. If you're not sleeping, if you're not recovering, that's terrible. Uh, it's hard to have good health. And another thing is body mass index. How many people are walking around with a over excess weight, spare tire? Yeah, I got a couple of hands coming up here, which is again,
Well over 70%.
well, and it's okay. It's all right. All I'm saying is, if you don't have a good lifestyle, you can make a decision. You can make a choice right now. You can decide this very second, this very moment, or at any point in your time in your life, you want to do better, because that is the prerequisite. That is the decision point. Until you decide, nothing happens. Nothing. Uh, and if you're happy with that, fine. If you're not happy with that, if you want to do better, do better. That's the option. That's the responsibility, and that's our right, and that is our potential. Another thing is I'm going to talk about, besides the basic lifestyle, is stress management. People don't realize or understand the importance of stress in the heart and cardiovascular health. I'll just give a quick summary here. Uncontrolled stress, and please feel free to jump in at any point. But your biogenics PhD project, which turned into 68 various self-regulation exercises, a large part of that, the motivation, was the research and work by Dr. Selye in the 30s and 40s, I believe, that when he did a lot of his work on stress and its effect on everything. And literally, it's a stress effect on everything, especially chronic stress. If you have chronic stress, you have cortisol running around, you have all sorts of chemicals, you have all sorts of reasons not to feel good. You are in a fight or flight sympathetic overload. You're going to burn out, and you're going to basically burn out your heart. You're going to it's you have to have a good stress management technique if you have stress in your life. And frankly, at least for the past 2 years or so, the stress has been going through the roof. Incredible. Um, how do we control stress? How do we manage stress? Now, there's many different ways. There is meditation, there is transcendental meditation, there is, of course, prayer, there is sitting still, there's all sorts of techniques, there's breathing techniques. But one thing that I want to suggest and talk about is a very simple process called autogenic training. Born in 1912, so kind of pretty old at this point, over 28,000 scientific references, well over. And this was the foundation for Dr. Shealy's biogenic system. And actually, let's take a few minutes to talk about autogenic training and biogenics, how it relates to heart, cardiovascular, and just overall health. Please.
Well, stress is multiphasic, multi-chemical, multi-cause. Autogenic training trains the brain to go into, well, a state of detachment. If it isn't something you can change, then don't play broken records around. Don't wallow in manure. Autogenic training helps you detach. And it's important to get it out of the street if a car coming at you. But to worry about it is as bad as being hit in the wrong one. It raises your cholesterol. It raises your blood pressure. It raises your pulse. Stress is harmful. There is no useful stress. The more you can avoid it, the better you go. And if you do autogenic training twice a day for 3 months, you will train your brain for the rest of your life.
There is a bigger part of this program too, biogenics, over 68 various exercises. Now, did you have cardiovascular disease and disease states in general when you developed the system in the 70s?
Oh, of course, we've been aware of that, but it in medicine doesn't deal with it. Psychology doesn't deal with it. Psychiatry doesn't deal with it. Only holism deals with it.
And that's the answer. The answer is indeed holism. And the reason is that the healthcare system or sick care system is fragmented, literally fragmented. First of all, it's missing the essential piece of who we are as human beings. It's missing the soul and the spirit, because that's who we are, made in the image and likeness of the Creator. And the other interesting thing about this is, and this is why the conventional healthcare system does not have the tools to truly address wellness. It never has, it never will. It's not designed that way, it doesn't have the capacity. It's just not built for that for that foundation. It's missing the essential of who we are. We are the creators of our lives. Now, the other thing that happens is the mind. The mind is the control center, and the mind is where we get to decide, literally decide, what happens in our life, what patterns we bring in, what patterns we extinguish. In other words, as long as we become aware of things that work for us, don't work for us, and things that we should be doing, and we follow through, that's the big one, follow through. That will be the essential foundation for taking care of yourself. Now, the trouble is a lot of people don't feel that they are worthy of being taken care of, or they have no faith in anything but the pharmaceutical industry. And that's one of the biggest factors, mental and emotional. And frankly speaking, I've seen a couple of patients, clients in the clinic, and most of my customers, patients, clients, are actually very much health and wellness oriented. A lot of people basically have been through the windmill, so to speak. They've been through all the drugs. They want to get off the drugs, or they've been trying to get off the drugs, or whatever is they're doing with the conventional is not working. And that's because they're missing the foundation of the health and wellness and the human blueprint, the understanding and the follow through on the things that actually can reverse all these conditions. Interestingly enough, in medicine, we don't talk about it. Every 7 to 10 years, 7 to 14 years technically, the human body, every cell will regenerate. Almost every cell will regenerate. So if we incorporate better patterns, new patterns, we can actually make a huge difference. Now, let's also not forget to talk about certain supplements. And I do want to mention a few things, especially when it comes to cardiovascular. Now, there's, of course, the basic essential, which is there's the essentials themselves, which is a good B complex with a multivitamin, trace minerals, plenty of B complex. You got to have that for the cellular energy. That's Dr. Shealy's two a day of essentials. So then there's Youth Formula, which contains MSM, molybdenum, and vitamin C combination, which doubles the vitamin C combination, which is good for immune system, also great for the heart, and raises DHEA, dehydroepiandrogenase, which is anti-stress wellness hormone, by 60% naturally. Another thing that is essential, especially for the heart health, is magnesium. But most people don't do magnesium right. Magnesium is best through the skin, topical, magnesium chloride. When approximately did you do the research on magnesium and related to DHEA?
Well, almost 20 years ago.
Almost 20 years ago. I think there was a patent at some point on this. Yeah. So magnesium chloride. So Dr. Shealy literally demonstrated that simply applying magnesium topical on the skin, bypassing the liver, bypassing the first pass effect, you can actually not only raise the magnesium level inside the cells, which is where magnesium is, but you can also raise DHEA again by another 60%. Now, vitamin D3 is another thing that's essential for most people. And as far as the dosage on that would be, 50,000 in IUs, one little capsule. You can do that either once a week if you're over 130 pounds, or every 10 days if under that. But there's a few other things that are very good for the heart. Most people are familiar with nitroglycerin, which is specifically for the heart, opens up the vessels. Now, nothing wrong with that medicine, but there is something much better than this. And by the way, please don't use what I'm going to mention with nitroglycerin at the same time. That's not a good idea. But if you want to use a similar type of a product that's not nitroglycerin, there's something called Nitro Extreme from Kyani. Let's talk about that a little bit.
Nitro Extreme was made by a company called Kyani, and I did research on that 10 or 12 years ago. And it is totally safe. It gives you increased energy, and it's excellent for lowering blood pressure. I mean, it's the top of my list. You'll find a link to Kyani Nitro Extreme on the website.
realholisticdoc.com. What other supplements would you recommend in general to a person? And I have my list that I usually work with. But let's say a person comes to see you in the clinic or asks you, what would you recommend in terms of supplements in addition to basics?
Lowering cholesterol. And in no circumstance will I recommend a statin drug. I mean, I figure statin drugs are worse than taking nothing. Interestingly, lecithin and trimethylglycine are the top of the list for lowering cholesterol safely and effectively. And obviously, in addition to autogenic training.
Another thing that I like to use with the metabolic type of a syndrome or cardiovascular is actually TMG. Have we talked about that? Trimethylglycine. Oh, that's right. Yes. Now, if a person has diabetes that's contributing to the heart issues, there's also options on that with besides the drugs. And there is the first things that I would go to, of course, lifestyle, stress management, or supplements. That's the essential foundation. But you also have to have the proper mindset oriented towards health and wellness and the desire to get better. But in terms of other supplements, as I mentioned, and we have about a minute to go before we transition to the break, and stay with us during the break if you are on YouTube Live and Facebook Live, and if you're not, join us, because there's a lot of stuff that we do during the break that you don't get to see if you're just simply on the radio. All right, so actually I'm not sure I have enough time to continue talking now, but maybe we'll take it into the next segment.
Well, the important thing is bypass surgery.
Yes.
And bypass drugs in general. And you can have a healthy heart long into your 90s and age 100.
And beyond 100, literally.
Yes. But you have to start with the basics. And the basics are nutrition, attitude, and exercise. And sleep. People who sleep 6 hours or less have more accidents than drug and alcohol addicts.
Amen to that. And we're officially on a break.
But
we can talk over that music bed for a couple minutes.
Yeah.
Oh, can we? Yeah, I just wasn't.
It goes about 20 to 30 seconds, so you're welcome to talk over it.
Gotcha. Well, it's
just music.
And do we have any questions online yet?
We do. Okay, we have a question online. A gentleman asking if you can comment on the benefits of fasting and the best way to do it, intermittent or 3-day, etc.
I'll start. I love this topic. Fasting is one of the best things that a person can do. First of all, we eat too many calories. That's number one. Number two, we eat the wrong types of food for the most part. So whatever break the liver, the gastrointestinal system gets a break from all the stuff coming in, that's just a welcome vacation. Just imagine you go away to Caribbean in the middle of a snowstorm. I mean, that's how the body feels when you give it a break. That's the bottom line. Now, the several ways to do the fasting. One is an intermittent fasting, which is basically you can one of the easiest ways, literally, compress your food meal intake into, let's say, a 6-hour window. And you can do it gradually. You can, if a person snacks 24 hours continuously, obviously not a good situation. So whatever you can do to make your breakfast a little later, break fast, meaning that's literally break the fast. So have it later, maybe at noon, and then have dinner by 6, and that's it. Now, I'm not saying to increase the quantity of food, but that will give your body a chance to recover and regenerate. Tremendous benefit in terms of the studies, in terms of all the organ systems, cardiovascular, absolutely. Personally, I've done up to a 2 to 3 week fasts, including water fasts myself, and some juice fasts. Otherwise, the idea is wonderful. If you can tolerate that, that's great. Some people can. Some people are going to have a hard time. What's your perspective?
A week stresses me out the gourd.
Mm-hmm.
The longest I've gone is a week, and I hate it. Under no circumstance can I recommend it to anybody.
And there you go. Different systems handle it differently. And again, Dr. Shealy had one experience. I was able to tolerate 3 weeks. Now, I'm going to say, at the end of the first week, I felt like crap. I literally did. I had no energy. But by the second week, it was just basically getting my second wind. And by the third week, I felt like a newborn, literally. But I felt great, And then I started eating again, and well. So that's a wonderful question. Any other questions?
We have about 2 minutes.
2 minutes to
2 minutes till we come back.
till we
Okay,
come
we
back.
do have another question.
Mhm.
First of all, she says, "Where can I get a shirt like Dr. Sergey's? It's fabulous."
Thank you. Actually, I'm gonna ask the people who are listening, but also putting in questions online. We're having a little competition, Dr. Shealy and myself. Which of our shirts is going to take the first place? What do you think? We were actually competing this morning.
And I started with it, and I bought it for him.
Yes, sir. So either way, you win, because that's your concept. But
She says her potassium was 5.5 in early March. 2 weeks later, it was down to 4.3. Is it okay to start taking tart cherry juice?
Yes.
Yes. Wonderful. Tart cherry juice will be a good addition. Yes. And by the way, that's a very interesting point. Potassium, either high or low, can be very dangerous. So that's where my emergency room background kicks in, and that's where I get into, I pay close attention to that.
We've got about a minute. You want to do another question?
Yeah.
Okay.
Another question. Yeah.
Okay. Does the Sapphire Enhanced Adrenoscaler device have the same benefits as wearing the Sapphire pouch?
No.
We haven't measured that. Let's put it that way.
Yes. It does reduce free radicals, but we do not know its effect on calcification of the heart.
Well, the good thing is that it does a lot of great things. It has lowered blood pressure, sugar, free radicals, coagulation of blood. In other words, just lets the blood flow freely. But we haven't done certain studies related to that specifically, so we can't make that statement. Possibly. Yeah. Mm-hmm. Yeah.
Now, back to Wellness Wednesday with Dr. Norm Shealy and Dr. Shealy-Sorin.
And now is your turn to ask questions on the phone. 417-447-1777.
And if we don't have questions, I do want to talk about some things. Now, conventional medicine has never recognized, has not recognized the aspects of holism, but there is one disease that actually comes close. And that's actually called a broken heart syndrome. Do you know what I'm talking about?
Of course.
Yeah.
Sadness over a loss of love.
Yes. Grief. There is, interestingly enough, I've been talking to my colleagues, cardiology, and no one has a really good explanation for the broken heart syndrome. And in a way, that's the easiest thing in the world, because what happens is when you are when you lose a person, or when something bad happens, or a terrible situation, or however affects you, the stress. This is what we're talking about. The stress is enough to kill you. So the medical community has acknowledged that through that statement, but there's no solutions to that. And that's a very interesting thing. Do we have a caller? All right. Yes, please.
Go ahead.
You on the air?
Hello. Good afternoon, Dr. Shealy. My question is, could you recommend anything for chronic shoulder pain?
Chronic shoulder pain.
Well, chronic
Yeah.
shoulder pain, I would recommend bathing it in magnesium lotion. If it doesn't make a big difference with it in a day or two, then the second treatment would be a TENS unit.
Where would be?
Ten-
I'm going to jump in with one other suggestion. I'll see what Dr. Shealy has to say about this. But musculoskeletal, PEMF.
Well, in the long run, it reduces pain even better than TENS, but acutely, I would try.
TENS first.
It's simpler. If it works, you don't need the pimp.
Mm-hmm.
And would you put the 10 patches right on the pain, or would you
No,
what area of the
never
body?
on the pain. Above and below or on other side of the pain.
I see.
And actually, I'm going to stay on this topic for just a second, actually, because this is important. Dr. Shealy, being the founder, the creator of TENS unit to begin with, actually, a lot of the people who use the TENS unit, physical therapy and otherwise, they're not doing the right thing with it. It's not meant to be on for 10, 20, 30 minutes. It's supposed to be there for a long time, 24/7. And the goal is to actually reset, retrain the nervous system. That's so you just again, it's being used, but it's not being used properly. Would you agree with that?
Excellent. Yes.
Yeah. So if you have a
Okay,
TENS unit,
wonderful.
keep it on,
I
and
do. Yes.
you bet. Yeah,
Yes, I do. Great. Thank you so much for that.
you bet.
Appreciate it. Thank you.
Blessings.
Another call.
You're
Hello.
on the air. Hello.
Is this the great dynamic duo?
Yes.
Big Bob.
How are you, sir?
I got favored and blessed, other than knee pads gone, but got three quick things, and I will make them quick. What do you will boron stop osteoporosis and arthritis? Boron.
Let's address that first. Osteoporosis and arthritis. Boron is fantastic. 12 milligrams minimum. Number 2, make sure vitamin D3. Number 3, magnesium and weight-bearing exercise or a vibrating plate.
It's grams.
Okay. Secondly, have you heard of a new technology called iTeracare? It has about 60,000 frequencies in it. Looks a little bit like a hair dryer, but it puts a blue light out. Looks like something out of Star Wars or Star Trek. Have you gentlemen heard about that?
Actually, how do you say it again? The name?
iTeracare.
iCare. Okay.
I
have
do not know it.
Can you please send that to that information? That'd be interesting.
Absolutely. Thirdly, and most importantly, someone very dear to me, I've talked to you about it before. She went through COVID, and lost her sense of taste and smell, and she's lost about 25 pounds in a local facility in Rogersville. And she doesn't want to drink. I do have her on mineral water, specific kind with 81 minerals in it, and it's got frequencies in it too. Some 6,000 frequencies, but she just are there particular things? Because I know there's got to be tens of thousands of other people that are going through this with parents, mate, grandparents, or other things. And I'll get off and listen. And thank you all for the wonderful job you do for us.
Blessings. Thank you, Bob. I'm going to say that first and foremost, when I've gone through that illness as myself back in 2020, actually, some time ago. It was pretty terrible. Loss of taste and smell is indeed a factor, but here's what I'm going to say. The human body is made of 70% of water, and we have to keep hydrated. We have to. If we don't, it's very difficult to get anything else right. And that has to become a decision, not so much based on the desire to eat or drink, but the fact that you have to eat or drink while you're recovering.
And I want to intervene. Don't drink city water.
Yes.
Fluoride is poison to your health in general. Get a filter, get rid of fluoride, possibly chlorine, but particularly fluoride.
Absolutely. One thing I would advise, and this is what I was doing for myself, and this is what I advise for everyone else that I've seen go through this illness. And I work with a lot of people in the emergency room and in the clinic with these kind of conditions. Is you have to, even if you're not feeling well, put yourself on a schedule like you would be at work, for example. These are your duties. That's your responsibility. Glass of water every half an hour or every hour or so. Make sure you do that, whether you feel like it or you don't, because that is what's going to help flush out some of the viral effects. It's going to help with a lot of things. And if you don't hydrate, chances of recovery is going to be, well, prolonged recovery is going to be much longer than you have to. So very basic things. And of course, stress management, just letting go of the things that are not serving you, because stress is another huge factor. The amount of stress that happens in either acute or chronic illness can be substantial, and dealing with it and working with it is essential as well. Knowing what to do and how to do it. We have call. Yeah, please. Yeah.
You're on the air. Hello?
Hi.
You're on the air.
Hi, Dr. Norm. You have mentioned before some supplement Dr. Norm, you've mentioned something before, a supplement that you take in the summertime to keep yourself from getting sunburnt. What is that?
Astaxanthin, Astaxanthin. I take 30 milligrams a day.
So you take that every day, not just in the summertime?
Yeah, I take it all year.
30 milligrams per day, and that helps with sunburn.
Yes.
And as a matter of
Yeah,
fact,
it helps the immune system in general.
as well. Absolutely. It's one of the, in addition to the basics, that's what we usually recommend for people who have allergies or any kind of immune issue. It's
Okay.
Yeah.
Allergies or immune. And then my other question is, if you start taking Armour Thyroid, can you ever get off of it?
Rarely.
Well, it's Dr. Shealy is right, but there is a reason. There is an interconnection between the thyroid hormone and the other hormones. So if you can correct all the other underlying abnormalities, I've had several occasions where we got a person clinically aligned again, hormonally, endocrine, basically in terms of regulation of the central and autonomic nervous system, and the thyroid normalized. So it is possible, but you've got to get your entire system on track before that can happen.
Mm-hmm.
And if you want to do that, then you need to work with somebody who understands the blueprint of how the body works, not just the disease.
Okay.
Mm-hmm.
All right. Well, thank you so much. And is there anything else you do for sunburn to protect sunburn naturally, except the astaxanthin 30 milligrams per day?
So the question is, other natural options for sun protection?
It's the best.
Okay.
I don't think you try anything else other than astaxanthin.
There are some natural products out there. They do work somewhat well, but of course, it's if you're out in the sun long enough, you will get burned. I tried a number of things, and it still happens to me, if I'm not careful. But much less likely.
Okay. Thank you. Thank you, guys. Bye.
Yes. Another question. Fantastic.
You're on the air.
Hello.
Hi. Thank you so much for taking my call.
Mm-hmm.
Welcome.
I really appreciate you, both of you. I am wondering if you have advice regarding tinnitus or tinnitus. I'm not sure how you would say it.
Tinnitus or tinnitus?
Oh, yes.
Yes.
Air and fire bliss. You need to use it once a day, and it can take 3 months, but it frequently takes it away.
And the best thing about using those things is that also you have the extra benefit of optimizing with the fire bliss the hormone system, and everything from pineal all the way down to the sex hormones. And there is and with the air bliss, you're actually increasing or optimizing neurotensin and oxytocin, which is basically a feel good, I'm okay. So actually, in addition to hopefully getting rid of the ringing in the ear or tinnitus or tinnitus, how people say it. There's other benefits.
Oh, thank you. I actually already have those oils. I might have
Wonderful.
to get some more. I might have actually run out a little bit, but that was interesting because I was wondering how to know how to combine them because I was wondering, is it appropriate to use all of them or combine
Yes.
them strategically?
As a matter of fact, the best combination is all 5 bliss oils. I mean, it comes in a package, so you get a little saving there.
Yeah.
But the best thing about it is that each individual oil has its benefits. There's the earth bliss, which is for calcitonin, which is bone health, osteoporosis, all pain, generally musculoskeletal. There is, let's see, what am I missing? Water bliss, right? Which is basically, aldosterone, water balance, but also feelings and emotions. And there is did we mention crystal bliss? Yeah, crystal, which is a free radical reduction, and that's lots of other things. So the combination of 5 it gives you the things that you don't get individually, and the combination of the 3, by the way, the earth, the fire, and the crystal will also regenerate the telomeres, the end tail of DNA, which kind of decreases by 1% each year under the best of circumstances, more so otherwise. You can actually grow your telomeres and live longer than 100 if you do all the things right.
Okay.
So that's another reason to do the oils. There you go. Yeah.
Yes.
Especially if you have them. Use them. Yeah.
I just also, I'm so happy I have them. Thank you so much. And I actually have not been using them. I think I just got out of my good habits a little bit during the last couple of years. I have kind of let some things go. So I appreciate the reminder. It's amazing that I already have them. But I wanted to know, is the PEMF, PEMF, is that device, is that safe for someone who has tinnitus or tinnitus? Could it make it worse? No. It's a big investment for me, so I'm considering it.
Totally safe.
Mm-hmm.
Okay.
And so many benefits as well. So let's talk about PEMF briefly, and we can address it more, of course. There's 3 modes. Used to be 1 mode, now it's 3 modes. Portable unit. You can have it with you. The upgrades are fantastic, as a matter of fact. I don't have the box with me right now to show you, but it's just imagine a halo, like that's a coil that goes around, you can put around the head. That's, by the way, the second setting for gamma. Gamma is your optimal, I am okay, I'm feeling good. Great for all kinds of mental health, in other words, just feeling good, optimal, focused, brain activity, optimization, addictions, things of that nature. We did research with opioid addicts on that, wonderful outcomes, where otherwise it's usually terrible, less than 20% to 20% success rate generally. Tremendous outcomes. The first mode is the general sweep, which is kind of regenerates the cells, recharges everything, trillions of functional units of your body called cells that make up who you are. And the third mode is the delta, which is the 0 to 3 cycles per second for sleep, relaxation. But we also found that to be very helpful if you have a hyperactive nerve activity like pain, sciatica, back pain, neck pain, otherwise. You put it over the area of where the pain is and see what happens.
Oh, okay. Because I was wondering if the relief would take time, like if there's a cumulative benefit over the course of a week, or if someone might actually notice a benefit with one treatment. Sometimes
one treatment sometimes takes longer. It depends on how your cells are doing, because it works on a cellular level. For someone who's in a pretty good place, it's faster to see the results. Then again, somebody who is Dr. Shealy, for example, you ask him what does the device or what does some supplement do? He would say, I'm okay, because he always feels good with everything. So how do you tell the difference? But if you have something that you'd like to improve, it may take a little time. Yes.
Okay. Thank you so much. I appreciate all that information. That's fantastic. I hope you both have a wonderful afternoon.
Thank you. Absolutely. Yes.
Thank you. Thank you.
Yep. Another call. Hello.
You're on the air.
Hello?
Hi. Can you hear us?
Yes.
Yeah, you're on the air.
You have a question?
Hello. Yes. So my question is, I've been having this buzzing in my right ear, and it doesn't seem to want to go away. It's been going on for about 3 or 4 days. I've had, little it's like a tone sound. I've had it before in the past, but this time it's 3 or 4 days and it's just not going away. I don't know if it's tinnitus. I don't know what it is.
Well,
But I
it sounds
wanted
like
to get an idea.
tinnitus. And again, I would try a fire and air bliss once a day.
Fire and air bliss. Okay.
Hmm. For people who truly have tinnitus that's going on for a long time, it can take a long time for that to also respond. Dr. Shealy, what would you say the average response time to?
Well, 2 to 3 months is if it's been a long term, but I would think 1 to 4 weeks in a minute.
Okay. And is there any other possibilities it could be, or does that sound like what it is?
It could be so many different things. I mean, you'd have to, if you're here in Springfield, we're happy to see you, by the way, but you can also just touch base with the doctor if you have. Make sure there's not an ear infection or, basically something called eustachian tube dysfunction, which is like fluid accumulation for one reason or another. There can be Meniere's disease that can be associated with just being dizzy, off balance. There's so many things. The ear is fascinating. There's a lot of things going on there. It's not just any one thing.
Okay, yeah, I've seen Dr. Shealy before a long time ago, but not for my ear thing. But so that would be something I'd have to probably come in. I couldn't do a consultation over the phone or something.
Yeah, that would be probably best if you like. So the number is 417-351-5221, and yes, a consult would be very helpful. Yes.
Okay, Meniere's disease. What can be done for that?
It depends. That's a rather unpleasant condition, but we can talk about that if that's where other findings are leading to.
Okay, but it's normal. Like if you have not normal, but if you have tinnitus, then it can buzz for days like that. Just that there's a low tone in your ear that would.
Those are descriptions more consistent with the tinnitus or tinnitus, but I've seen that with Meniere's. Yes.
Okay, but tinnitus can do that though. It can go for days, like just this low tone in your ear.
Yes.
Okay.
Yes.
Okay. Okay, I'll try the fire. I have that. Actually, I'll try that. Thank you.
Wonderful. Don't forget air and fire, please.
Air and fire. Okay.
Yes, ma'am.
Air and fire. Okay, thank you.
Yes, absolutely. Yeah. Do we have another question?
Well, let's go back to the heart. The heart of the matter, or the matter of the heart. It's essential to be stress-free in every way, psychologically, physically, every way. Start with autogenic training, biogenics, nutrition, physical exercise, and sleep, the critical factors in having a healthy heart. Lower your cholesterol with lecithin and trimethylglycine. And if you're 40 or above, get a calcium score as a baseline to have a knowledge of whether you need a sapphire pouch. Any other thoughts?
I just want to close with a very simple statement. There is a way to bypass the bypass surgery. There we are. And the answer is holism. That's it.
Now.
Yep. Sorry, did we have something on the Facebook? Actually, I think what we'll do is we'll take the Facebook questions and YouTube questions after the break. But we only have 1 minute or so left. Yeah. Oh, 3 minutes. So
3 minutes.
We got plenty of time.
Yeah, time for one question.
Yeah. Let's take a question from online. Yeah.
Okay. The question is, what do you think of the Coenzyme Q10 for the heart?
Yes.
Excellent. I take 3 of the capsules a day. And I think it's one of the essentials for the heart.
Absolutely. Another great supplement. Thank you. Yes. We can do another question if we have time.
Okay. Question is, what do you think of? Do you recommend a ketogenic diet?
Yes. Unless there's a certain type of a kidney disease or other specific contraindication, which is very rare. A ketogenic diet will keep you away from the sugar, from the starches, from the from the things that contain a lot of Roundup and otherwise, and it's a healthier diet to begin with. But the very important thing on that is it's not just a protein, because what most people think is ketogenic is protein, protein, protein. That's not necessarily the case. Make sure that majority of the food that comes in is true non-starchy veggies. If it's not, you're not doing yourself a favor.
Carbohydrate is the enemy.
For the most part, especially, it wasn't always. I mean, I used to enjoy pizza in Italy and other places. I grew up in Europe, and now bread is poisoned, pasta is poisoned, everything is just, well, it's a mess. But folks, there's good news. If you stay healthy, chances are we can do better than this. One minute, okay. And is there another quick question we can address, Real?
There is. Two people actually chimed in with the fact that they have low sodium. So what causes it, and how much salt do you need to eat?
Low sodium is one of the most complicated, I'm going to say this, clinical syndromes, conditions that I'd love to answer that question rapidly, but you can there's conditions, there's predisposing things to low sodium that have to do with too much fluid, not enough fluid, or the fluid is not a problem, but there's an issue with something else that's causing ISO, or the same amount of concentration. Before, if there's a low sodium going on and you're not, most common thing is what's called psychogenic, or the term. People drinking so much water. I would recommend drinking lots of water, but not to the degree that you're going to dilute your entire electrolytes. And if it's more than, let's say for a 50 kilogram person, 100 something pounds, it'd be 50 ounces. So not too much, not too little. And we are officially done with the radio part of the program, and we'll continue to stay on for a few minutes if there's any other questions or comments on YouTube or Facebook. And this is a holistic presentation on heart disease. So if you're interested in going that route, let us know. We are at realholisticdoc.com. We're also at the clinic, 417-351-5221. And
Vision Communications Incorporated, its management, or advertisers. Vision Communications Incorporated is not responsible for the validity or accuracy of information presented on this program.
I think we're done with the disclaimer there, and that's basically that. So we are, I do believe we are off the radio, and if there's any other questions or comments or thoughts.
Okay. You have an equal amount of votes for the shirts.
Equal.
You guys are tied.
We're tied. All right. Well, I kind of figured, but. Okay, so no shirt, no shirt here is a winner. We're about the same. All right.
How many grams of the boron do you use for the arthritis is one of the questions.
12 or more milligrams. Actually, I wrote how long?
Grams.
Grams, yeah. How long ago did I write an article for the medical society here? Boron is anything but boring. Lots of benefits, including hormonal system support.
Let's see. What are your thoughts on gout, testing for it, and cures for it?
Gout. The testing, I'll give you a conventional concept here. I think that it still holds. If you want to check for gout, you really want to look inside the joint, not in the blood. There's uric acid crystals. And what I do in the emergency room, if it's appropriate, I would aspirate. Sometimes if it's a question of whether it's infection or inflammation, you can aspirate a joint or just, let's say, wrist, elbow. I want to make sure I come across real clear. A joint like elbow or wrist or otherwise. You want to see what's inside inside there. What's inside the fluid? Is it uric acid? Is there pseudo-gout? There's a number of other findings. And that's the best way to do that. It's an inflammatory condition, and there are medications acutely and preventive, but gout can also be somewhat controlled if a person watches their lifestyle what decreases the inflammation. Turmeric is fantastic. There's a few other things, garlic. What are your thoughts about that topic?
Well, yeah, you need to make the proper diagnosis to treat it.
Right. And it's interestingly enough, this is where acute medicine comes in. If a person is having symptoms for the first time and it hasn't been diagnosed properly, make sure you check it out. Because I've seen people who came in with gout to the emergency room and actually into my office with much more serious conditions that needed immediate attention. So don't leave it to chance, but once you've been diagnosed as a chronic condition such as gout, then it's time for a holistic approach, reversal of the factors and patterns that lead to it.
Okay, we've got one last question.
Yeah.
And this question is for someone who took the JJ vaccine, can you flush it from your body?
No.
I'm not sure what the answer is. I can tell you one thing. If you want to detoxify, just a general detoxification, I'm going to just speak in general terms. So please, let's make sure I'm very clear on that. The best thing that I would recommend is intravenous vitamin C, Myers cocktail plus C, plus a combination of intravenous ozone in a package of about 5 to 10 each, spread over, let's say, a couple of treatments a week, can help with a lot of different factors, including inflammatory, vascular, lots of different things. And that's the first thing I would do if I was concerned about something of that nature. And we do that in our clinic, but if you're not here in Springfield, obviously find somebody you trust, please. Mm-hmm. All right.
Well, take care of your heart. It is second only to the brain in importance in life.
I remember I was at a conference where it was a cardiologist and neurologist going back and forth, basically almost killing each other physically over what was more important, the heart or the brain. And I just and I was hoping that somebody would just stand up, and I wasn't me. I wasn't brave enough at the time. I was just a student to say, "You're both important. Shut up," But it's the bottom line is it is truly the heart of a matter, and the heart of the holism is take care of yourself. Bye.
And until next week, have a good one.
Hmm.
You guys still on?